you like the idea of attracting new patients from medical doctor referrals. Patients who are referred by doctors tend to start care and stick with it. And it's just more wonderful to work with patients like that. But are you in a place where you have either tried to reach out to doctors, but you feel like nothing's ever come of it before, or you're not really sure how to get it going? Well, you're in the right place as far as this is Chen Yen, your 6 and 7 figure practice makeover mentor at introvertedvisionary.com, and your show host today for Cairo Secure. And I look forward to helping you with this, with what's working right now, so that you could apply this to your practice to attract patients without always having to feel like you need to be marketing all the time. Because isn't it exhausting to feel like you need to be spending money on ads, trying to figure things out, spending time on it, and then sometimes it's not even fruitful? What if you had a way of a approaching medical doctors such that they do refer? Because imagine if you even had three medical doctors sending you 1 or 2 referrals a week. What would that do for your practice? It's one of the few approaches where once you get it set up, you don't have to always constantly be um, spending money on marketing or marketing all the time, because you can be getting referrals from medical doctors even 3 months from now, 6 months from now, a year from now. So, but here's some of the most common things I've been hearing from you. Quite a few of you wrote in and said this. So we're going to be talking about answer your most common challenges and questions today. And for example, I hear, oh, I get no response from them. Uh, Many MDs simply shun chiropractors and tell patients not to go to one. Or I don't know how to get in touch with them. How do I get past the gatekeeper? Some of you have even connected with MDs. So someone wrote in, we're connected to MDs, but referrals aren't coming in. Or I have medical doctor patients, but they're not referring to me. So what do you do? So go ahead and type in the chat right now, like this actually, if you have ever experienced any one of those situations before, and type in the chat, what scenario have you experienced? So I get a better sense of what you're dealing with, and I can help you best with it. So let's talk about each one of the challenges that people, those of you who wrote in have mentioned you're experiencing and what to do about it. The first thing is the no response from them. So one of the reasons for this many times is because of not really having an approach that works to get their attention, that would make them want to talk to you. Because many times medical doctors are busy, just like you, and they have people trying to reach them, whether it's vendors, drug reps, other providers, nurses, all kinds of people trying to get their attention. And they have a full schedule of patients. So, what would have them want to talk to you and even start to develop that relationship with you? Many times, one of the most common mistakes I hear is not really having a strategy for this and not really having an approach that works. So, um, now, as far, and we're going to be talking a little bit about that coming up next, as far as your first step with that will work. Another uh, Another kind of concern, which one of you wrote in, said hard time finding medical doctors who are congruent with chiropractic philosophy and treatments. Isn't that frustrating when you feel like there are medical doctors and perhaps other conventional medical practitioners who feel skeptical about what you do, when you know that what you do is amazing for your patients, and in fact it's helped your patients to the extent that much further extent than drugs and surgery might have when they have go through the conventional approach for some situations before coming to see you. And so uh, this is where some medical doctors, from having worked in different settings, so I've been in the inside of, for example, at Merck, at the FDA, in the outpatient setting, inpatient setting over the years, and working as a pharmacist. So I've seen the insides of what, in working with many medical doctors over the years, I've seen what gets medical doctors to refer and what doesn't. And from the comments I've heard from medical doctors and over the years, what I've noticed is this. Unfortunately, not all medical doctors understand, and some maybe never will, because they're pretty set in their ways that it needs to be this certain way, and then it needs to have, it's drugs and surgery, and because that's what they were trained, and everything outside of that is too risky, kind of a thing, right? And so um, the it is true that not all doctors will refer, but you don't need that many medical doctors. You just need a handful of people who are your biggest champions. Just as we talked about before, even if you had one or two providers, or one to three providers sending you one or two referrals a week, that can be very significant in the number of people you can help over the years. And so, the as far as that goes, don't get discouraged because you think, or you've even experienced it before, that some medical doctors shun chiropractic. Also, I'll say, from having worked in the conventional medical system for a while, I noticed that there are many conventional practitioners, whether it's medical doctors, nurse practitioners, pharmacists, and other kinds of conventional healthcare practitioners, who secretly would prefer holistic options. Do you know, I have a client of mine who says she has she knows of um, a surgeon who drives, and he drives like 45 minutes to see a chiropractor because he doesn't want his colleagues to know that he's seeing a chiropractor. Can you believe that? Right? So there are medical doctors who secretly are into holistic options as well too. So believe me, there are enough of them out there to fill up your practice in terms of helping you, them referring you, and helping their patients. So another note I got from one of you was, I don't know how to get in touch with them. Oh, actually, I did, before I mentioned that, I also want to mention that, the idea of how, many MDs simply shun chiropractors, tell patients not to go to one, or having a hard time finding MDs who are congruent with philosophy. So that's exactly why you need to educate them, because the reason why they are not educated about chiropractic is because they haven't really learned about it in school, like the full scope of benefits that it can have for patients. Some of you are into other kinds of things like functional medicine as well, and other types of things aside from just chiropractic as well. And so, if not you, who is going to educate them? Many times they are open to helping with patients' outcomes. And when they hear about something that makes clinical sense to them and it does work for their patients, they would be open to it. So, this is perfect for your area of opportunity to take leadership as a chiropractor, as someone leading the profession, to change the paradigm of what many medical doctors and the conventional healthcare system providers think about chiropractic and holistic options. So, okay, so another comment I got from one of you is, I don't know how to get in touch with them. I don't know what would be the most effective way to reach them in my area. So that I hear quite a bit, right? Like, what should you do? Should you uh, email them, try to find their email and email them? Should you go to their office? Do you call them? What do you send them something by mail? What is the most effective approach? It's interesting because I've heard of a when practice management companies suggest that you write down a list of 100 doctors in your area, and then look at reaching out to all of them. And when I heard about that, I thought, oh my gosh, it's so exhausting. just hearing about it, right? Whereas our clients aren't actually having to reach out to that many people, and they're getting referrals. So what is the difference? And so it's about having a simple approach and having a system to plug into that works. For example, one hot tip about this is we could first start with low hanging fruit, and then we could go beyond that to um, beyond the low hanging fruit, right? So, one way of approaching medical doctors with low hanging fruit, I mean, as far as low hanging fruit, is who do you have mutual patient with, where you have a patient you've gotten good results with, and then they also have seen a medical doctor. Or, as we think about reaching more medical doctors and helping their patients, we could also think about other conventional medical practitioners too. It could be nurses, it could be PAs. For example, we've had clients who have been nurse practitioners or nurses, and they've said, "Hey, don't forget about us. We're actually easier to get in with than medical doctors." So, uh, so yeah, so then, and also other holistic practitioners. Could you develop relationships with naturopathic doctors, acupuncturists, health coaches who might do different things than you, and you support each other, and it's more of a team approach. So low hanging fruit is for whom you have mutual patience, and then you just need to have a way of what do you actually say to them, what would actually get them to start referring to you. And let me help you with this first step here coming up, about which was asked by another chiropractor who said, "Well, I'm not sure how to get past the gatekeepers." So, because the gatekeepers try to screen you out, don't they? That's their job, isn't it? The front desk person, they are there to try to uh, keep just the most important thing to be passed along to the doctor, because the doctor is busy. So, how can you get their attention when there's that gatekeeper right there? So, one way, so there are definitely ways to get past the gatekeeper, and as a part of our MD referral success systems. And one thing that you could do is to go around the gatekeeper. There are a couple ways to go around the gatekeeper. So one way is to reach out to medical doctors directly through messaging them on LinkedIn. And then, because that way you're not having to have that gatekeeper, right? And so, would you like to have an exact script that a chiropractor client of ours has used and gotten in with medical doctors through their script? So if you would like that, I'm going to give this link to you, and you can see it below also, and you can just click on the link below, and or copy and paste, or it, and get this free script. So it is, you can go to www.getmoremdreferrals.com /LinkedIn script. So again, it's www.getmoremdreferrals.com /LinkedIn script. So you can go there now, click on the link, and download the free copy and paste template you could use to get in with medical doctors. And then you just need to know what else to do after that ends up translating into referrals, right? So the first is getting your foot in the door, and then how does that end up translating into referrals? Because it's one thing for them to know about you, it's another for them to actually think of you first to send their patients to. So a second way of getting around the gatekeepers is something that our chiropractor clients and other holistic health practitioner clients are doing very well, in terms of very successfully and getting referrals, is what is to educate them, speak in front of them. So how can you do this? So you could either be educating them one by one. It could even be done through Zoom, or it could be educating their office of providers and their staff about it. In fact, did you know that front desk receptionists sometimes are even better sources of referrals for patients than even the doctor themselves? So what do you say to them, right? So things like that. And then there are other opportunities to speak in front of a room full of doctors as well, whether it is in person. I know during these times, depending on where you are geographically, there are still opportunities in person where you could be in a room full of medical doctors that are it's like 10 of them or 50 of them or even more than that. It could even be done through a webinar way. So meaning that, for example, if you speak in front of medical doctor conferences and you're a main speaker there, then you can be or you could do in services for hospitals and then be in front of more than one doctor at a time. Because how many of you would love to be in a room full of doctors? We had a client of ours who was in front of who did a talk in front of a very well-known hospital in the New York City area and got referrals from medical doctors, and that really helped him grow his practice significantly. Uh, so as far as the um, notice the opportunities, because you might think, well, I don't want to speak in front of a group of doctors. I don't feel like I feel like I need to know more before I do that. Right. So here's the thing. You don't have to even start with speaking in front of a handful of doctors. It could just be one provider. And then or it could be someone who's not a medical doctor. It could be a nurse or a nurse practitioner or a PA or someone who might just feel like a bit less intimidating to you because you feel like you don't you just feel more comfortable, right? So um, in terms of feeling like you need to know more, you know so much more about chiropractic than other medical doctors already know. So don't worry about it at all. Now, as far as um, because when we actually work with our clients, what we do is help them come up with one, not several, but just one. So it's basically one framework, one what I call signature talk that you can give in front of potential referrers, so it translates into referrals sooner rather than later, because it is one thing to just educate them and for them to see you as someone who's smart and clinical versus to see that you can really help their patients also, because that's what translates into referrals, not just when your talk is very informative, because there's a difference. And so uh, it's about having the ability to do both. So uh, yeah, so having that one signature talk dialed in is really important. And then you can use it in different situations, whether it's in front of one doctor you're speaking in front of, whether it's in front of a room full of providers or something else. So, and it could be webinar based, right? You don't even have to leave your house or feel like, oh, I need to go and get dressed and go see someone at the doctor's office. You don't even need to do that. It could be at home. So, okay. So another note one of you sent in to me that I want to help you with is this. So we are connected to MDs, but the referrals aren't coming in. So this is what I like each one of you to do. If you either have an interest in getting doctor referrals, but you haven't yet, or you're currently getting referrals from doctors and you would like to have more referrals coming in from medical doctors, is to draw a triangle. So draw a triangle, and on the very top of the triangle, I want you to write down. So what I'm going to have you write down are because in order to want to get more referrals from medical doctors, it helps to have to understand why they might not be referring as much, right? So this triangle is going to help you with that. So on the top part of edge of the triangle, I want you to write down connection with you as a person or provider. So this is connection with you as a person. It's not necessarily what's your clinical knowledge and everything. That's certainly helpful. But if you think about it, who, if you were had your choice of referring and you knew, let's say, several people you could refer to your patients, of those people you choose, who of those will you be more likely to choose? Is it someone you tend to like more as far as your relationship with them, enjoy talking to, or is it someone who is a big grumpo bumpo? Right. So like really grumpy and all the time. So probably someone you enjoy talking to and have a connection with. So that's one thing which is on the top of the triangle to put on there. So connection with you as a person provider. The bottom left of the triangle corner, I want you to write down um, trust in your modality. So this is about whether the extent they trust in your modality, but not just your modality itself as far as trust in chiropractic. It's also trust in the kinds of in terms of helping the patients that as far as you would like to track, right, with those kinds of health issues. What is their trust in you for those kinds of things? And what is their understanding of safety and efficacy? Because don't if they have a concern about its safety or efficacy, they're not going to refer. Many medical doctors are concerned about lawsuits these days, in a very understandable way. So they don't want to be putting their license on the line to refer someone to you, and then you do something with their patient and that they regret that they ever sent you because it's causing them trouble and including legal trouble. Would you agree? Like that would be kind of scary for them. And so many times medical doctors take the stance of, well, I don't know what's going on with that, so I'm not going to even go there. That's why they may not be referring. So it's helpful for you to, I mean, in terms of that corner of the triangle, to write down um, the trust in modality, including safety and efficacy. The other corner of the triangle, the final corner of the triangle here, right? Final corner is top of mind awareness. So, what is their top of mind awareness about you? And when do they, because many medical doctors are busy, they go about their day. Remember, we talked about how, they're seeing patients all day long, they're probably really booked, and then all kinds of people trying to get their attention, whether it's vendors, drug reps, and nurses, and all kinds of different practitioners and providers, the patients and the patient's family, all kinds of people trying to get their attention. So, what would have them out of their busy day when they're seeing patients? They think, ding, 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 ding. Oh, I need to refer this person to this chiropractor, right? So, what would make them actually think that? So, that's really important as well. So, I gave you the three triangle points. Now, what to do with it is rate yourself. Think about one medical doctor you would like to have more referrals from, and think about what you would rate yourself on a scale of 1 through 10, with 10 being the highest. What would you rate yourself for each corner there? And then we could look at how can we get you closer to a 10 in each of the three corners of the triangle. And that's what will help have those medical doctors referring to you more readily. Is, the question to ask yourself is, do you have a system that supports getting referrals? Do you have a way of approaching the doctors to help them feel more comfortable and confident in you? And, for example, these are things that we help our clients with. So let's talk about the um, here's one final thing in terms of a common kind of concern or challenge and frustration kind of a feeling, right? So one of you wrote in, I have MD patients, however, still they're not referring to me. So this is a situation where, remember the triangle, where they might have trust in you as a person, as a practitioner, perhaps. They may have trust in your modality. Um, and perhaps its safety, right? But they might actually not necessarily know or be very clear about certain situations you're looking for referrals from. Maybe they don't know. You think they might know, but maybe they don't know. Maybe they're seeing you for more generalized kind of pain, and they have no idea. Even though you can help them with this, they have no idea it could help support improving fertility, or in terms of the yes, and so there are in things that they might not truly know about clinical wise there. Also, what about top of mind awareness? Look at that corner of the triangle about top of mind awareness. So yes, they see you as as a patient, but when they are seeing a patient, do they come across the patient and they think, ding 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 ding, this is a perfect situation to refer to that chiropractor, right? Are they crystal clear about that? So it's about how are you communicating that to the medical doctor, so that when they are in the room with the patient, that they remember that. And once you have made an initial connection with a doctor, by the way, those of you who want that script again for the LinkedIn script, that's just one way to get connected, right? There's several other ways, but I want to give you at least one way to get started with. So that is you can go to www.getmoremdreferrals.com/LinkedIn script. So in terms of after you have started developing that relationship with them, remember, it's also about how do you continue that relationship so that they refer and they continue referring. Because have you ever experienced before, maybe you've heard your colleagues say, hey, I reach out to that doctor. I thought they would refer. We had a really good conversation and they're not referring. So many times I notice when chiropractors tell me that and I ask them to dig in deeper and find out what's going on, I noticed that it's because usually they think they have this unrealistic expectation of them getting a whole flood of referrals from just having talked to the doctor once, right? So usually, just think about it. If someone just met you and they said they could help your patients, are you going to send every patient to them pretty much that you think they can help? Like, how likely is that, right? So the likelihood goes up when they're educated more and feel more comfortable about those corners of the triangle, for example, especially the safety and efficacy, which you can do by educating through a webinar, a Zoom, or a talk, like I mentioned to you before. That speeds up the process of getting referrals sooner rather than later. Or also, what else? How do you keep them in your top of mind, keep in top of mind awareness, and help them feel comfortable in starting to refer, having a system for that in place that supports you getting referrals. So that's what you'll need next. And for those of you who want help with this and would like systems to plug into that work, or want guidance to get this going so that you're able to start attracting those referrals, remember, be nice, right? Like three providers sending you one or two patients a week, that adds up, doesn't it? So and especially with ad costs rising these days, and with you perhaps experiencing that the sources of getting patients maybe aren't working as well, or even if they are working as well, it's really important to diversify, especially with things changing and shifting. And so reach out to us at introvertedvisionary.com. So go there now and then click on the button to get in with us, and happy to see how we can help you grow your practice faster, whether it's through doctor referrals or in other ways. So, um, to you, helping more people who need you and waking up the planet, because more people need to know about chiropractic, more people need to know about holistic options that can really help them beyond just what they may know about with drugs and surgery. And you are an important key to that. You're an important person to be able to change um, the trajectory of people's health situations and conditions and issues. But more people need to know about you. And that can only happen when you are able to educate more, and also have providers even start referring you, because it just will snowball from there. So to you, having an amazing year. Go to introvertedvisionary.com, and happy to help you further. So till next time.